Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about verifying insurance benefits for specific CPT codes. Depending on your specialty, you may be experiencing a gap in the ability to check benefits specific to CPT codes and services that you offer in your practice. This isn't going to be for like E&M codes that everyone bills out or for administration codes or something like that. This is going to be very, very specific to not only services and CPT codes to specialties, but also payer coverage specificity. I have allergists, and because I worked in an allergy office, I can speak firsthand that struggle with this as my main example for skin prick testing and serum mixing and rapid desensitization. You can't just use the benefits that are given on a portal or through a general eligibility check, benefits check, to understand patient benefits when it comes to these services. This is going to be the same for orthopedics, cardiology, urology, GI, you name it. If you're in a specialty, and I'm sure you're nodding your head if you have any idea about the billing for your specialty on how difficult it is to get the specific information for specific services. Now, for the specialties that have a lot of hospital procedures, cardiology, urology, GI, surgery, things like that, you probably see less of an issue with this because most likely you have a dedicated department that only focuses on benefit verification when it comes to referrals, authorizations, and coverage, because that is very important because you have that whole wrench of ASCs, which is the ambulatory surgical center where you might perform the procedures. You might do some procedures in your clinic, and then you have the hospital component. So a lot of these specialties that work in these various different places of service probably most likely have a dedicated person or team that explores the benefits information for patients a little bit further. But when you have specialties like allergy that don't go into these other places of service, they're in this kind of little area of gray where they're not just office visits where you can bill just E&Ms and EKGs and venipunctures and administrative injections. They have very specialized, expensive procedures, but it's still done at place of service 11. They don't go to the hospitals and things like that. And so because of this, and a lot of them are private, it is hard and expensive to hire somebody that just does benefit verification. Usually the staff that are responsible for this are also the staff that are checking in patients, they're collecting money, they're answering phones, all of that, and it's a lot. And it's hard to balance your time when you're patient facing and answering phones and things like that. Unfortunately, by not having someone who can drill down and get specific information for patients based off specific CPT codes, a lot of money can be lost. And it's very, very sad to see as someone who knows the battle between the cost of hiring someone to focus on that and the overhead for that and the return of payment if it is covered and the return on investment, and trying to weigh that out and make sure that you can even hire somebody, because right now we know there's a staffing shortage. There's a lot of components. So I wanted to talk today about the importance, honestly, no matter what, of really drilling down and finding out each specific patient's benefits for specific services in your practice. A lot of this can come down also to training patients, communicating to patients, setting expectations. Patients are not very good at taking ownership and understanding their benefits. And honestly, I understand why, because as a patient myself, if I were not to work in insurance and healthcare and the world of crazy that it is, I wouldn't understand it. It would take a lot of effort to understand the nitty gritty. Sure, deductible. I mean, a lot of people don't even know what a deductible is, but honestly, that's not hard. Coinsurance isn't hard. Copay isn't hard. Premium. But those are the main things. People don't understand how things can change in their benefits based off a service offered. Like, oh, that's not a covered service, or that service is actually going to be covered at a different rate, or it has a different requirement or something like that. That's where you lose patience, because honestly, we can't even keep up in the industry, right? I mean, it's pretty bad. So it is important as a specialist that you communicate that kind of stuff to patients and put some things on them and providing them the tools and resources necessary to help them help you when it comes to understanding their coverage and costs. Whether that is, like I used to provide them the group MPI, tax ID number, the CPT codes, diagnosis codes, that they would need to call the insurance and find out if certain services were covered. It was on them. And then they would have to sign something when they came in, acknowledging that they understand it was on them. If something's not covered, we will bill them, blah, blah, blah. Again, you have to consult your contracts with each payer if you can do that, but we do have to start holding patients more accountable, but at the same time, we have to educate them. We have to help them until they get the hang of it, basically. But that doesn't mean that you should still be in the dark and you should just leave it up to them. You really should be checking these high-priced items so that you're doing your due diligence as a business owner. Medication codes, J codes, those can be really expensive depending on, what kind of medication it is, how old it is, how many units you're giving. That is something specific that should be looked upon. Any of your behavioral health codes, because sometimes they're considered behavioral health, sometimes they're considered medical, depending on the insurance company and whatever rules they have. So if you're in behavioral health, I'm sure you've experienced that. And depending on what state you're in, can play a big factor in that as well. And the carve-out plans that you need to send the mental health, but then the medical stuff has to go to the medical plan. I tell you, I can't keep up, I'm telling you. Any imaging and lab codes that are really expensive. And then your procedure codes. So in therapy, allergy therapy, desensitization, you have your basic allergy codes for the shots, fine, whatever. But the big expense comes from the allergy testing, the 95004, and then comes in the mixing of the 95165. Insurances all have different unit restrictions, how often, how many units can be billed. Some are 12 consecutive months, they have a limited number. Some are per month, some are per day. It is so hard to keep up. And the only way that you're going to know what their outline and their expectations are is to call them and find out specific for that CPT code. And is it based off the patient's plan? Is it just their overall benefits for anybody who has Cigna or anybody that has Aetna, that it has to follow this? You have to have that information. And then you have to have a cheat sheet so everybody is aware of what those different parameters are, because again, it can be different and it's hard to keep track of. So you have to have something to do. I have found that a lot of this information is not on the provider portals that you have access for the payers. They are not on even the billing guidelines for the insurances. You have to actually call, and you have to have a patient example, and you have to give them the date of service and the CPT code and the diagnosis code and of course the MPI or tax ID number. And you have to ask the right questions. They don't volunteer the information just willy-nilly. Like I called the other day, I asked about skin prick testing. She's like, oh, it's, towards coinsurance after deductible is met, blah, 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 all the basics. And I said, okay, but do you have a unit restriction? And if you do, how often is that restriction? And she goes, oh, hold on, let me get that information for you. I had to ask the right question. I had to be proactive. And then she comes back and she goes, oh, it's 120 unit maximum over a 12 consecutive month period. Okay, that is good information to have, because this patient already had 120 skin prick tests and wants to have more testing. Well, that's going to be all out of pocket for him. So I have to have this conversation with the patient going, okay, these are your benefits. They've paid all of this, but now if you need any more within the next 12 months, it's all going to be paid out of pocket. We can do it as self-pay you would have to pay at the time of service, or we can put you on a payment plan, a short-term payment plan, but this is why, and these are your benefits. But if I wouldn't have done that ahead of time and I just would have billed the patient, it would have denied, saying, exceeded the maximum units for the time frame or whatever it would have been. And then I wouldn't have been able to bill the patient if I didn't have something pre-skin prick testing where the patient acknowledged that it might not be covered and they are willing to accept that as needing to pay out of pocket. And then you have to play with that and patients being upset and the cost, and it's just a whole thing. Again, being proactive, not reactive. The other thing is finding out if these specific CPT codes needs an authorization or a referral. You might be able to bill as many units as you want, but you have to have an authorization first. And if you don't think the patient needs an authorization or referral because you're just looking at basic benefit and eligibility information where it says no referral or authorization required, most likely it's attached to an office visit situation, not a procedure, then you go, oh my God, you bill it out, denies for no authorization, call the insurance, they won't retro an authorization, and you've lost all that money because you can't bill the patient. These are the things that places are running up against because they're not taking the time to call and find out the specifics on these CPT codes. They're taking what's available to them on the portals or what's interfacing to their EMRs with the information, and they're running with it. And unfortunately, that cannot be done. Yes, it saves time, but it's not saving money. It's actually making you lose money. There are also situations with patient coverage and the plans they choose that maybe they get the first 3 office visits without having to pay a copay, but after that, they have to pay a copay. Or the first 3 visits do not go to deductible, but after that they do. But whoever's checking it just sees it says no deductible. They're not reading the fine print or they're not reading further, and things get miscommunicated and not expected from the patient to pay a copay, or they get upset when they get a bill, and that contributes to more confusion, upset patients, and ultimately the staff get upset because they're getting kind of things from patients that aren't very nice, and it's just very, very bad for everyone. It is very important that people pay attention and understand all the different little caveats that are out there, and there are many. And there's a lot just within certain payers based off of the plan patients choose. You can't generalize just because someone has Blue Cross Blue Shield or Cigna that they're all going to have the same coverage or all going to have the same requirements, which I'm sure you already know, but it's just that much more important to stress when it comes to high dollar value services. When staff call to get this information, hopefully you put some kind of workflow into place and you can figure out how to put this in a designated person's responsibility. And maybe it's just for certain CPT codes or certain services over a certain amount that gets charged out. But something needs to be done. But when they call, they need to make sure they record the date and time of the call, the representative they spoke with, what was discussed, all of the details of payment, authorization, referrals. They should be asking all these questions. Unit-specific billing, if it's applicable to the CPT codes that you are asking them to call about. The reference number for the call, they should always be asking if it's not provided already and recording that. Because what happens is a lot of these insurances will make memos in the patient's account from the call. Again, something you would want to verify when you're calling, asking if they're putting a note in the patient's account. And you need to make a note with all the details in your patient's account on your side. I have had many successful appeals go through where something is called to get the information. The information provided is different than how the claim processes. We are able to provide all that information. They are able to look in their system to see matching information was given, and they overturn the denial and they pay based on the information given. They do say, however, in the future, now that you know what the true coverage is, you can't get it. And we're like, that's fine, no problem. We're just happy we got it. But that's not always the case, but I have had quite a few successful stories in that situation. That's why it's so important to record it. And remember, if it didn't get recorded, it didn't happen. So in conclusion, and as I end this video, some important takeaways is if you're in a specialty where you have a lot of high dollar services that you're noticing are getting denied and you're losing money, it's probably because the benefits verification isn't being done correctly or your coding isn't correct. That's another place, little side note to look at. But if the coding looks correct, I think it's really important to go and call the insurance on these denials to find out the exact reason instead of just going off of the denial reason on the ERA or EOB. And once you identify it, having that discussion with your staff, putting workflows into place, making sure you're checking specific CPT code coverage for these patients by calling the insurance, recording all the information, asking CPT specific questions about like units billed, time frames that they can be billed, if an authorization or referral is required. Those are probably the biggest ones that I can think of right now. But making sure that your staff has a workflow for this before patients are seen, giving them ample enough time to get information to be able to communicate to the patient if they find out something that is required before they're seen, or if something's going to have to be paid out of pocket. So that can be communicated to patients before they have the services rendered, and they can give you some kind of authorization to do it anyway with the acknowledgement of the information you provided and accepting the financial responsibility. If you have any questions or comments about this, I would love to help you, so please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. Take care of yourself, and we will see you next time. Bye-bye.